We're here talking about caffeine and drugs.
And alcohol.
Mostly marijuana because it's used all the time, and alcohol. So I'm Dr. Hillary from Cultivate Fertility. Welcome everybody. And this is Dr. Kara. It's late night for Dr. Kara in Connecticut, so we have to say thank you for her being here and alert. And
it's just because I'm really good at getting the amount of sleep I need to get. And so the 8 o'clock webinar is just barely making it before I can have my wind down time before sleep, because it's very important. But these are important topics to our fertility patients. And so that's why we're talking about them today.
So there's a chat, and you're welcome to use the chat and ask us any questions that you might have about the subject. Obviously, it's one that gets kind of charged and people have a lot of feelings about, because we're talking about vices that a lot of people use and quote unquote need to get through life and use regularly. And we're talking about the woman's use and also the partner's use, especially if it's a male partner that you're with, that you're using his sperm. So because these have an effect on egg health and on sperm health. So that's why we think it's a really important subject. We get to talk about it some with our patients, but not as much as we would love more time in the office to talk about all these subjects. So that's why we're teaching courses, like classes this way about it.
I also think it's a good point to say that I think, and I could never measure this, but I think I've seen a number of couples who we tweak these things, the daily use of these toxins to their reproductive health, whether it be alcohol or cannabis or whatever it is, or way too much caffeine. I think that we've tweaked those things, and I have seen a healthy pregnancy result over and over again. So it seems so simple and obvious. People know you shouldn't drink so much alcohol, but it happens, and so this is a good talk to just remind people about like the real research and stuff that's on this. And I do think that we catch it regularly after people have been to all kinds of doctors of trying to get pregnant or keep pregnant. And I think it could be as simple as just tweaking these things.
So it's great to know if you're like struggling with your fertility, or if you're just starting on your fertility journey, like what's your philosophy going to be? Obviously, there's a million stories of women who go and they didn't change their lifestyle whatsoever and they end up getting pregnant. So that can most certainly happen. And many stories occur of people getting pregnant when they were like drinking tequila or out late at night, right? Like, so
we hear that all the time.
We're not saying that this is imperative for you to get pregnant. It's just that if you're looking at all the different factors that you can control, and that's the thing that's awesome, that we want to just empower our clients and patients that, like, of the things you can control, what can you kind of do to make things optimal and just harmonize things a little bit. So let's first talk about caffeine. So Dr. Kara loves to throw around a number, which is
200 milligrams.
200 I think that's caffeine.
Right. So there are a lot of people that kind of think I shouldn't be drinking any caffeine, right? Because caffeine is a central nervous system stimulant. It gets your blood pumping. Maybe that's bad for developing fetus, or maybe it contributes to miscarriage. And the research doesn't really show that a moderate amount of caffeine can cause a miscarriage. I just can't find that in the research. So it seems to be, 1 to 2 cups of tea or coffee a day seems to be pretty safe. And we're allowed to have that. But caffeine creeps in really high doses sometimes. People get like 4 shots in their coffee, of espresso. And so I think you have to kind of like think about it a little bit, but usually I say, 1 cup of coffee is fine to have, unless it makes you really nervous. If you're the kind of person who drinks that cup of coffee and then your heart's just racing, that's probably not good for a developing baby. That's just what I think about it. What do you
Yeah,
think of that?
well, that's the whole bit about your nervous system and your stress hormones. So what I notice is that I have patients who have a hard time sleeping, or I have patients who are anxious and stressed and nervous, and they're drinking caffeine. And so my first move is, well, before I put you on an aid or something to sleep, why don't we remove the thing that we know affects sleep cycles and sleep rhythms and stress hormones, or especially with anxiety. I mean, I have had so many patients come with anxiety and they're like, and I'm like, well, detailing what they eat or drink. And it's like, they're drinking a cup of coffee maybe in the morning and then something in the afternoon when they feel tired. Well, you're giving yourself a stimulant that's a known, it's known to produce anxiety. It speeds up the heart rate. And so for sensitive people, and so it's one of those fascinating things where it's like, okay, well, before I like manage your anxiety with something, how about if we just try to remove everything that could be contributing to anxiety? And lo and behold, in a lot of patients, it makes a big difference. And so as it
Mhm.
relates to your fertility, we talk all the time about stress hormones. And so for some people, caffeine really kicks up the stress hormones and makes them feel in that kind of fight or flight stage. And if you're one of those people, I would highly recommend not being on it on your fertility path. Like just substituting it with Swiss water decaf. Decaffeinated coffee is one of the most toxic products on the planet. And so if they're doing it chemically, and so a Swiss water decaffeination process is a much less toxic option. And so you want to always look for Swiss water decaf.
Wait,
Or
it says it on the label. I do not buy decaf coffee, so you have to explain this. Like that's
I know
why would
Kara,
I? But it
Kara
says it
is
right
the
on there.
yeah, Kara's a caffeine consumer because it really doesn't affect her. Kara can have a cup of caffeine at like 9 at night and fall right asleep. I'm not that way. If
Mhm.
I drink caffeine after noon, after 12, it really affects my sleep. I might not think it's going to. I fall asleep okay. I always wake up in the night. So I have to be really careful because I've done a detox, and when I'm off caffeine, like I sleep awesome. It's the best sleep I've ever had whenever I do a detox. So obviously it's that caffeine. Anyway, when you're looking for decaf coffee, yes, it says right on the label, Swiss water processed or Swiss
Okay.
water decaf, or um, and any kind, most organic coffees are that way. So, and coffee is one of the most sprayed plants. It's a highly
Yes.
produced, everybody around the globe wants it. So there's a lot of pressure on the plant, and meaning that the production has been manipulated and there's a lot of pesticides. So looking for organic coffee makes a big difference. But we always recommend that substituting even down, like knocking it down a notch, if coffee is really a hard stimulant for you, using green tea. And green tea is an antioxidant. Green tea helps with mood. Green tea
Has fertility research, so it
with
might actually really help with ovaries and egg quality. So green tea is an excellent choice, but people don't like the taste of it. So then what do you tell them?
not to drink it if they don't love the taste of it. You know what I mean? I'm like, what are you going to do? I think that there's really good ones. Like I tell people to try the Earl Green, which tastes like Earl Grey, but with it's Earl Green. I tell people to buy not tea bags, but try real leaves and see if they don't find a different affection for it when it's kind of fresh and flavored and see the right way.
And I think people do too much of the actual leaf and it can be astringent. So if you leave the hot water too long with your green tea, it gets more of that kind of tight feeling you get in your mouth. So if you just leave the water with the tea bag or the green thing for under 4 minutes or so and take the tea bag out, you're probably going to have an easier time drinking that green tea. And then you will get used to it. I don't think I liked green tea when I first drank green tea for a long time ago. And I just kept drinking it. And then my body just flipped and I love it now. So you
Yeah,
just
me too.
stick with it. Right.
And the one other thing about it is if you're caffeine sensitive, but you want green tea for the health benefits. If you put the tea bag in, pour the hot water on, that first release has most of the caffeine in it. So you can let it kind of release for 30 seconds, pour it off, and then pour the hot water on again, and you'll have a much lower caffeinated green tea.
And our Chinese professors used to walk around with these jars with the green tea in it, and they kept pouring the boiling water. Remember, that was probably the first time I was ever exposed to that. And I guess that second cup, the second pour, and this is like something my grandparents did just to be, saving money or something like that they would re-pour over the tea bag. But they were smart because that second cup had the most antioxidants. There's actually research on that. So if you just get a green tea kind of mug going in the morning and keep pouring water over it, you get medicine all through the day. It's actually a really good thing to do.
Let's talk about...
We're doing drugs now.
Cannabis.
Cannabis is the biggest one I get asked about. You too, right? Yeah. Okay, so I think one of the most astounding statistics about the cannabis situation is that women who use cannabis assume that it's safe in pregnancy, and over half of them use it all the way through pregnancy. That's a real statistic. So we do have to, get this information out there that's probably not a good idea. And I think it's because people are like, oh, it's natural, it's a plant, it's fine. I can use it while I'm trying to get pregnant. It's particularly harmful when you're trying to get pregnant, because we do think that it's looking like the research is pointing to problems with implantation. So when there's a fertilized egg and it goes through the fallopian tube and then it goes into the uterus and wants to kind of get stuck there to get its food source, and that's where it's going to grow in the womb. That process, somehow the cannabis and THC is bothering that process. The second part of it that I always try and mention to people is that it's fat soluble, that like psychoactive kind of thing with the cannabis, and that anything fat soluble crosses the blood-brain barrier, meaning that the baby's brain and nervous system might be affected, a fetus, I shouldn't say baby. And so you don't want a developing brain exposed to something that can change around the development potentially. And so I'm a big strict no on that. And a lot of my patients are thinking it's, too strict. And so that's why I have to always pull out that research. But it is definitely a no for me every time.
It's a no for me every time, for women, for sure. In the way that I won't want my women drinking alcohol during pregnancy. What we're just trying to do is reduce any kind of risk factor to the future baby that you have. But what's really interesting is that I find that my women are often okay with giving it up, but the men, their partners are daily smokers or fairly regular smokers, and we're marijuana smokers. And interestingly enough, like, marijuana has been found to really have an impact on a male's fertility, that it can decrease testosterone, that it reduces sperm motility, and that so it has a direct effect on the sperm. So it's always one of those things I ask, like, okay, if you guys are struggling a little bit, like, is your dude a regular smoker? Okay, let's try to kick that out and see if that is a factor. I think it's a pretty big factor.
I think it is. And that's one of those ones that I feel like I've seen make the difference. I feel like that's the difference. The man partner stopped doing this daily, whether he's ingesting it in drops or smoking in general. Anything you smoke is not good in pregnancy, that's for certain. But for the male sperm, they really can change those parameters. Like you said, the morphology or the sperm count, that can all change if you just change this chemical exposure.
And what about CBD? Like, what do you tell people about CBD?
Well, it's kind of the same discussion in that any drug you're taking, and this could be an over-the-counter drug, or whatever it is. Why are you using it? Let's do the balance here. What's the potential benefit of the drug versus the risk to the pregnancy and developing fetus? And the CBD is usually used for a chronic pain or kind of like a stress picture. So we have to find other ways that are safe in pregnancy is sort of that discussion, but it's definitely a no. And we don't have a plethora of research on this. It hasn't been like years and years and years that people are using so much CBD. It's like in everything, right? But I think that we do have enough to say that that's not a good idea. And that we do have enough on other things you can use for those same complaints that make me really much more comfortable. So that's a no too.
And obviously drugs, stimulant drugs, cocaine, MDMA, amphetamine, those are all like hard, strong no's. Like, get into recovery programs. I mean, we've all seen some scary situations with women who are addicts, and it's a really hard thing. So anybody that's using drugs like that, and thinks maybe, I just use it occasionally or something, no, those need to be completely gone, and you get help. Same as with pain medicines. If women are on pain medicines that are any of the oxycodones, or that it's really important to be off of those medicines as well for your fertility and pregnancy.
And some over-the-counter medications. So we assume things that we just buy at the pharmacy, you don't need a prescription, are good, but those are still drugs. So be really careful with that kind of stuff too. And one thing that's really an easy tip is just to ask the pharmacist in the pharmacy you go to, because pharmacists are really well educated on all of this. And so they will let you know. And so even if you're just trying to get pregnant and you have a cold, or you have a cough and you're just buying a medicine, you can always ask them, is this going to be safe if I'm pregnant? And they'll lead you in the right direction. One of the over-the-counter drugs that I try to address is the antihistamines, because antihistamines are safe in pregnancy, definitely most of the ones people are on. But for getting pregnant, it can interfere for some people. So it's something to just think about, like, what am I taking every day? Is it going to be a good idea? And I count sugar as a drug too. So this is, and there's research that sort of says it is. Remember the cocaine research and the sugar. So you
can watch all about it in our Fertility 101.
Yes, I do. But I find that really important to note, because so many people are trying to get off sugar, right? We all know that we crave sugar. If you have any child that you hang out with, you know that they're going to want to eat more and more and more sugar. And it is addictive for us. Think about the honey and the bear. And it's hard to get off of sugar. And it's interesting, because if you have a low kind of processed sugar intake, and then all of a sudden you like go to a party and you eat dessert, or you go out to eat and eat dessert, and then it just kind of builds upon itself, then you're like wanting more and more sugar. So it is one of these substances that's really hard to get off of. But for egg quality and development of an early fetus, it's really important not to have too much processed sugar. And I think a lot of people miss that point. We just think we're doing it because we don't want to get diabetes, but actually it's really important for the quality of the embryo.
Which is why doing a 30-day detox is such a good idea pre-pregnancy, because it can really help to kind of get you off some of those things.
So all right, our most common reproductive toxin, though, is alcohol. That's the most common reproductive toxin I think that we have to address, because that one affects us. We're born with our eggs, us females, right? And so we have this store of eggs. And if we, are binge drinking in high school and college and whenever people do that, you're affecting the quality of your eggs every time you drink alcohol. So we just don't think of it as a reproductive toxin, but it's one of the biggest ones that, we get to age 40 and we want to have a baby, and maybe all that alcohol that we've had in the past is kind of catching up to us. So that one's a really important one to think about. Right? It's alcohol, it's just not fetal alcohol syndrome we're trying to prevent.
No, it's people's fertility.
Yeah.
The one I've being a older lady like myself, watching women are tend to be binge. Our society is sort of a binge drinky society, and especially women in their 30s or whatever tend to party a lot and drink a lot. Or we also have a kind of a wine culture where it's like, oh, I just drink wine when I'm making dinner or whatever. And I think that really starting to have awareness about how much you actually do drink. I think when I ask my patients, like, they're actually kind of shocked when they add it up, and they're like, oh my God, I have like
Really shocking.
between 18 and 22 drinks a week or something. It's like, okay, well, that's not moderate drinking. That's a lot of alcohol. And so I do this with my patients a lot, is like setting a goal for yourself. Okay, if you're going out to a dinner and you know that some women have a drink when they're getting ready, or then they go, and before the end of the night they can end up having 4 or 5 drinks. And so I think it's a really good idea in your fertile years, where if you really stopping at 2 drinks on a night out, and trying to, Kara's like a no alcohol if you're trying to get pregnant and for egg health, and that is definitely what the research shows. And I'm wanting to give women some ideas.
You deal with real people. I mean, I'm talking about the ideal situation, but real people do go to weddings and events and they drink alcohol. Or how about the corporate culture of drinking alcohol?
There's just a lot. It's a lot. And so what I really encourage is for patients, like for teenagers, I always teach them a bracelet system, but it actually works awesome for women as well. If they commit to, like, okay, I'm going to have 2 drinks and I'm going to enjoy my 2 drinks. I'm not going to drink them fast. And like other people might be having 4 or 5 in the time, but I'm going to have 2. So I tell them to wear 4 bracelets on one wrist. And the first drink they have, they move a bracelet over. And then they have a glass of water. So that's a water, because if we keep ourselves hydrated while we're drinking, like, it really helps our body. And then the third bracelet is the second drink. And then the 4th one's the water. And then you've kind of like, you're looking down. So when it's so easy after 2 drinks to want the third and to minimize the third, you're just looking down and saying, okay, no, I made a commitment to myself and my health, and that's where I'm at. And that's helped a lot of people just kind of make it through the day. Or it's a 50th birthday party and I'm gonna have 3 drinks. Well, instead of having 5, not a 50th, you wouldn't be getting pregnant, but a wedding. Okay. Like, wait a minute.
That's what we're doing.
I want to have 3 drinks this night. This is going to be like a fun big night. And so then you have your bracelets: drink water, drink water, drink water. And then you're done. And so that's kind of a great strategy.
It is. I bet that's
buy bracelets. Fun bracelets.
That's even better. You can buy jewelry and you can go to weddings. But the thing is, I think that people don't understand that about the alcohol, that it actually is just doing you damage. So minimizing it is a really good idea. And making sure that it's like conscious. Do you know what I mean? That it's not just like, oh, I'm out, so I have to have a drink every time I go out. It's not good for a lot of different things, but for your fertility, absolutely, it can have a big impact. And that's one that if the guys get off it, you can see, because sperm takes 70 days or so to make a whole new sperm set. If they go off it in that time frame, your sperm can be such better quality, and you might get a healthier baby. So that's worth it, as far as I can see. Well, Hill, okay, we made it through the alcohol, and it's not so much fun. So now you're not having alcohol, you're not eating sugar. What can you do?
I'm like, what are we doing?
Do that's fun?
Let's go dancing. Let's do a little dancing.
Okay, there you go.
All right. It's a, we don't want to make this seem unfun or have your life be unfriendly, but just to have awareness of like, oh, these things have an additive effect and they could be impacting my fertility. So, that said, well, I don't know what, but I feel
it is what it is. It is what it is. So that's the caffeine, drugs, alcohol, sugar talk.
yeah.
And we're gonna have more. We're gonna have a happiness talk next, so that'll be much
Yeah,
more.
next week for Webinar Wednesday, we're doing a happiness talk. So please, like, if you want to be part of what are the different strategies you can do to really optimize happiness and raise your vibration, we all could use that right now. And so please join us next Wednesday, 5
Well,
p.m.
I was happy to see you tonight, and I will see you tomorrow.
Thank you, everybody, for
Bye.
joining. It was so nice to be with you all. Take care. Bye.